Normally, sleep occurs in cycles, starting off with N1, N2, N3, then REM sleep, which in normal circumstances, the REM sleep stage only begins until after you've been asleep for about 90 minutes. However, for people with narcolepsy, REM occurs shortly after sleeping has begun. Other symptoms can include excessive daytime sleepiness, which involves falling asleep without warning, disrupted nighttime sleepiness, which includes fragmented sleep and awakening during the night, sleep paralysis, which is the inability to move that occurs while falling asleep or waking up, or even hallucinations when falling asleep or waking up. It is not necessary to have all of these symptoms at once to be diagnosed with narcolepsy. Narcolepsy type 1 is a disorder marked by the loss of neurons that are responsible for producing hypocretin, which is orexin. This is a chemical that helps regulate wakefulness and sleep by stimulating other neurons that release neurotransmitters that promote alertness, such as dopamine, serotonin, and norepinephrine. The reduction of hypocretin can also allow for cataplexy, which is the muscle paralysis brought on by strong emotions such as fear or anger. Narcolepsy type 2's cause is unknown but includes most of the same symptoms. However, type 2 is not characterized by a low amount of hypocretin. Instead, it has normal levels of hypocretin and does not include cataplexy. The causes for both N1 and N2 are unknown. Some data suggests that it can be linked to abnormalities in the immune system, where the body's immune system selectively attacks the hypocretin-containing brain cells because of a combination of genetic and environmental factors. Family history and brain injuries can also be traced to narcolepsy, but in very rare and sporadic cases. Since it's a chronic condition, there are no cures, but there is research in hypocretin replacement therapy. Behavioral approaches include planning short naps and maintaining healthy sleep hygiene to attempt to create sleep habits and lessen random sleep attacks. In addition to this, there are some medications available to lessen the symptoms. Modafinil significantly increases dopamine in the human brain by blocking dopamine transporters, and armodafinil inhibits the dopamine transporter and norepinephrine transporter so that these chemicals cannot be transported and so leads to increased concentration of dopamine in some areas of the brain. Both of these drugs lessen the symptoms of excessive daytime sleepiness. Sodium oxybate interacts with GABA to reduce cataplexy, excessive daytime sleepiness, and disrupted nighttime sleep. Pitolisant increases the release of histamine, a wake-promoting neurotransmitter, to treat cataplexy and excessive daytime sleepiness.